Okay, so first I'm gonna put on some gloves, possibly a face shield to protect myself from any blood splashing, and then I'm gonna look around the scene to make sure that there's no one else who's injured, and I'm gonna make sure that the saw is off and isn't gonna hurt anyone else. And then I can immediately begin my primary assessment and introduce myself and ask for consent. My name is Josh. I see you're in a serious situation. Can I help you?
Yes.
Okay, and then obviously I can tell that the person is conscious, but they're probably about a P on the AVPU scale for consciousness. Okay, so the patient has severe life-threatening bleeding, so I'm gonna immediately call for more advanced medical personnel. And to stop the bleeding, it would be really hard to pack the wound and put pressure on their leg. So I would apply a tourniquet. The tourniquet I'd put 2 inches above the injury, not on top of a joint or their knee. So I would put it on here, tighten it, and then turn the rod until it's completely tightened, and I can lock it in place and the bleeding stops. And then I would, usually on manufactured tourniquets, they have a place to write the time and that it was put on. While I'm caring for the patient and putting on the tourniquet, another responder should be taking care of the amputated body part. What they should do is they should take the body part and wrap it in sterile gauze and then put it in a sealable plastic bag, write the patient's name, date, and time on the bag, and then put it in a cooler or some sort of container with a ice and water slurry. To continue to care for shock, I can make sure the patient is laying down, and then I can check their airway, breathing, and circulation. For no more than 10 seconds. And then I can make sure that they're not getting too cold or too hot, giving them blankets if they get too cold, and make sure that they are not given any food or drinks. And then depending on local protocols, we can also administer them supplemental oxygen. And every 5 minutes, I'm gonna reassess the patient, their airway, breathing, circulation, and check on them every 5 minutes until more advanced medical personnel arrive.